So when we are talking about diabetes, I find it really interesting that certain patients, or not necessarily patients, but in the public, still to this day think of it as a temporary condition. And when I talk about diabetes, I mean its two main um, diseases, or like its two main conditions, or its two main subsets, which are diabetes mellitus type 1 and diabetes mellitus type 2. So for those of you who don't know briefly, diabetes mellitus type 1, it's the one that usually occurs at a younger age, although not necessarily always the condition, but majority of times usually occurs below the age of 30 or 40. At certain conditions that might occur late, it becomes like it has a different name, and we'll talk about it in a different video. And it is the autoimmune diabetes. So it's your own immune system fighting against itself and fighting against the pancreatic cells that actually release this insulin, the hormone that is responsible, one of the hormones that is responsible in regulating your blood sugar, or the major hormone, let's say. And when it destroys these cells, so you nearly have depleted insulin. So as a reason for that, thus comes the treatment through insulin injections or insulin pumps. Now for type 2 diabetes, which is the more predominant one that we have worldwide, type 2 diabetes, it's mainly dependent on what you actually consume, what you actually do in terms of physical activity, in addition to certain hereditary aspects. So family history is important in that aspect of having metabolic disease, of having diabetes, cardiac diseases, and etc. So these are the main two. And I made this video because I still have certain patients or certain people in public that ask me if they take this certain medication X, let's call it, for a certain amount of time, does the diabetes go away? Well, my frank answer is, once you're diagnosed with diabetes, you have this your actual entire life. Once the diagnosis is set, it's present, and it's chronically present. And that's the main aspect that I want to tackle here. And I don't mean just only in Middle Eastern countries or Arabic-based nations. It's actually worldwide. I've had this question from different nationalities. Does the diabetes go away? So you can control it, you can actually manage it, you can live with it for nearly decades and not have complications if you take good care of yourself. If you don't take good care of yourselves, complications will start to happen. Heart problems, cholesterol problems, nerves problems in terms of the lower extremities of the feet, kidney problems, and eye problems, and different ones as well. And so I always answer the patient, and I'm always honest with the patient. I don't try to beautify, if that's a word, to beautify the situation, or to actually make it more of a suitable way of saying that no, actually that goes away, the diabetes goes away, or the sugar regulates itself once you take the medication, and you can stop it actually. I'm always frankly honest with them. Diabetes is a chronic condition once it's diagnosed. Now I know some of you might say that they had diabetes during pregnancy and it went away, and it was a temporary condition. And that's true actually, because that would would be gestational diabetes mellitus. And gestational diabetes mellitus is a temporary condition at some or most of the times. However, it might actually continue and develop to diabetes if you don't take good care of yourself. Another thing that some patients might tell me that for those who have type 1 diabetes, that they or their child actually had diabetes and they were on insulin, and then insulin started causing hypoglycemia, which is low blood sugar. And so they stopped the insulin, and it's well controlled right now. The sugar is well controlled and they're no longer testing, which is a very, very, very serious issue right here. Because in type 1 diabetes, some of the people would actually go into a phase that is publicly termed the honeymoon phase, which is a transitory phase, a temporary phase that would actually, these remnant beta cells, which are the cells that secrete insulin, would get rejuvenated after the treatment with insulin. And they actually don't know they don't know the main reason behind that, or not fully understood. Part of it is understood. Some of the people think it's insulin therapy that triggers it. And they would enter this honeymoon phase for some months that these people actually behave like they don't even have diabetes. And then they would relapse back. So I would always tell my patients to always continue and check on themselves, to check on their children in this phase, not to leave them neglected. And that is the importance of awareness and education. And I'm very, very, very adamant that patient education, patient awareness eases the work of the physician and the work of the patient and the burden of the disease. So that's one of the aspects that I always work on, is patient education. So for just summarizing the points here, diabetes is a chronic condition. Diabetes mellitus, is a chronic condition. Type 1 and type 2. Once they're diagnosed, you have diabetes your entire life. Studies are still being done, research is still being done, or having some radical treatment for diabetes. However, as far as this video, there are no radical treatments, and we should be thankful on having multiple options and medications in managing diabetes currently. And that's very, very important. The last message that I want to say here is that taking a medication without actually going out of your way and caring for your health in terms of what you consume and exercise or physical activity, you only get like 60 or 70% of what's desired. Taking care of yourself, physical activity, watching what you eat, not smoking, and taking your medication are the optimal treatments for diabetes.